The United Health Foundation recently issued its America's Health Rankings 2021 annual report. It paints a complex picture of America's health during the pandemic, which includes reversals of long-time trends. Dr. Ravi Johar, Chief Medical Officer for United Healthcare of Missouri, joins us to discuss what can be done to address the successes and challenges facing the health of people in Missouri and Kansas. Thanks so much for being here. First of all, why don't you start by telling us a little bit more about this report?
Well, thank you so much for having me. It's a pleasure to join you. Yeah, America's Health Rankings is a report that's been developed by the United Health Foundation, which is the not-for-profit arm of United Health Group, in conjunction with the American Public Health Association. And this is actually the 32nd edition of this report. So they've been reporting for the last 32 years on America's health in the different communities. So this takes all the latest published information, public records, and paints a very comprehensive picture of what the health is like in different communities throughout the nation in general, and then it can break it down to different communities. And it gives us a really good handle on kind of what's going on health-wise. So it's really beneficial from that aspect. And this is unique in that some of the data was collected in early 2019, 2020, before the COVID epidemic hit, and then other data from 2020 and 2021. So we get a really good idea of what health was like before the pandemic, and then what the effects have been during the early parts of the pandemic.
So what are the health strengths then of Kansas and Missouri?
Well, there's some really good things there. In Missouri, the high school graduation rate is one of the highest in the country. So that's really good because we know that education helps with that. There's also a very low prevalence of HIV behavior, which is always beneficial too. Both states have a really good percentage of low incidence of severe housing problems, so we don't have a lot of homeless issues. In Kansas, there's a low degree of economic inequality, so that's really good from that standpoint. And the rate of childhood immunizations is relatively high in Kansas, so those are all really good points.
And what are some of the health weaknesses or areas where we can improve?
Well, in addition to a lot of the strengths, there are unfortunately some weaknesses. In Missouri, there continues to be a really high prevalence of frequent physical distress. So that goes along with decreased exercising, which we see in Missouri, and a high percentage of Missourians also avoided getting in for health care, maybe due to economic reasons. But both those things are things that need improvement. In Kansas, there's a high rate of occupational fatalities, a very high rate. And smoking is still very, very persuasive. It's just, especially in Kansas, not a lot of our residents are getting in for colorectal cancer screening. That's a real issue too.
So go ahead and tell us then about some of the key national findings in the report.
The death rate increased by 17% nationally, which is huge. Now we think a lot of this is due to COVID, the majority of it, but that's the first time we've seen an increase in the death rate. And that's a fairly dramatic one that we're seeing there.
What would you say then is exactly what we should be taking away from this report?
Well, I think the most important thing that we see from this report, in addition to all the things that each community needs to look at, the biggest thing that I think all of us need to look at is that we need to get in for our annual exams. We need to get that cancer screening. If you had a mammogram or colonoscopy that you were planning in April and you didn't want to get in because of everything going on with the pandemic, don't wait till next April. Get in now. I know a lot of people like to make New Year's resolutions. Don't resolve to wait till next year to get these health problems taken care of. Take care of them right now.
Very good information. Thank you so much for joining us, Doctor.
Thank you so much.
For more information on addressing the health needs discussed, go to uhc.com. There you can also get more health and wellness tips.